If your child has a fever, it's not the number on the thermometer that matters, it's these signs. Let me save you a trip to the ER. I see kids who are brought to the ER with standard viral symptoms every single day. And fever isn't dangerous on its own, and it's actually the body's natural way to fight off any kind of infection. We define a fever as a temperature of 38 degrees Celsius or higher. And using your hand to try to detect a fever is proven to be unreliable. So if you're a parent, one of the things that you absolutely should own and use consistently is a thermometer anytime that your kid is sick. Most fevers occur in the context of a viral illness and will resolve on their own in 3 to 5 days. And only about 1 in 100 fevers in children are serious. So let me go over some of the red flags that would indicate that this is serious enough to warrant a trip to the ER. Babies under the age of 3 months of age with a fever with a temperature of greater than 38 degrees Celsius need to be brought to the ER because their immune systems are underdeveloped and they're at higher risk of developing a serious bacterial infection. For all other kids, it's totally expected for your kid to be more irritable with a lower appetite than usual. But if your kid is super lethargic, like you're trying to get them to sit up or you're trying to lift them up and they're completely floppy, or they have inconsolable crying, or they're literally not eating or drinking anything and they're not pooping or peeing, or their lips or mouth are completely dry or cracked, these are all really concerning features that would warrant a trip to the ER. Other concerning features would be if your kid's having a difficult time breathing, like you take their shirt off and you can see the outline of their ribs when they're inhaling or exhaling, they have blue lips, or they have a stiff neck, or they have a new rash that's dark red or purple, or they have new seizures. These are all very legit reasons to come to the ER. And lastly, if your kid has a fever above 40 degrees Celsius that doesn't come down with medications like acetaminophen or ibuprofen, or if your kid has a fever above a temperature of 38 degrees Celsius every single day for 4 consecutive days, you should come to the ER so that we can assess your kid and make sure that there isn't a source of a bacterial infection. So most fevers are viral and benign, and because of that, mom and dad are going to be the best people to nurse a kid back to health. Here are a few things that you can do to get your kid back into fighting shape quickly. You really want to keep your kid hydrated with things like water, electrolytes, and soup. And as I mentioned earlier, it's totally normal for your kid's appetite to be lower than usual, and it might actually be because your kid's experiencing pain from a sore throat. So things like popsicles are actually very handy because they're sweet, and also it's soothing because it's cold. If your kid looks quite uncomfortable, you can treat them with medications like acetaminophen or ibuprofen. Just make sure that you're using weight-based dosing and regular intervals. But if your kid has a fever and they're playing totally fine and they're eating and drinking, you don't necessarily need to give them medications just to bring down the number. Fever in itself is not an emergency, and you want to treat your child, not the number on the thermometer. But if you're in doubt, we're always in the ER to help.